Hi, everyone. Welcome to Thanks for Sharing. I am your host, Jackie Pack. And in today's episode, I want to be diving into sex addiction within the broader category of process addictions. So whether you're in recovery yourself, a clinician who works with these issues, a family member, just curious, I'll shed light on what process addictions are, how sex addiction is a process addiction, and also explore its connections to attachment wounds, emotional regulation difficulties, and intimacy disorder. Process addictions, which are also referred to as behavioral addictions, refer to compulsive behaviors that a person continues to engage in despite negative consequences. Like a substance addiction, where a drug creates chemical dependency, a process addiction means being addicted to the behavior or the feeling that the behavior provides. The individual isn't ingesting a substance, but their brain and their behavior respond as if they were. Research has shown that any habit that shifts from a pleasurable routine to an obligatory compulsive act can be considered an addiction. In other words, all things that are capable of stimulating a person can be addictive. And whenever a habit changes to an obligation, it can also be considered an addiction. This means activities like gambling, eating, shopping, sex, internet use, gaming, reading fantasy novels or romance novels, even working out or watching TV can become addictions if they begin to dominate someone's life and health. Importantly, addiction, including process addictions, is recognized as a chronic brain disease by many experts. The compulsive behavior triggers changes in the brain's reward circuitry, similar to drugs and alcohol, leading to intense cravings and a loss of control over the activity. The person may get a psychological high or rush from the behavior, followed by feelings of guilt or remorse. Over time, they need more of the activity to get the same relief or the same excitement, which is a hallmark of tolerance in addiction. And if they try to quit, they may experience emotional or even physical withdrawal symptoms like irritability, anxiety, mood swings, or restlessness. It's worth noting that not all behavior compulsions are officially recognized as disorders by the psychiatric community. For example, gambling disorder is listed in the DSM-5 as a bona fide addiction. And internet gaming disorder is noted as a condition for further study. But other common process addictions, like hypersexual behavior, compulsive shopping, or excessive internet use, are not yet formally listed in the DSM. That lack of official designation doesn't mean they aren't real. People experiencing these behaviors often suffer significant impairment in their lives. And clinicians increasingly acknowledge the need to treat them with the same seriousness as substance addiction. In fact, sex addiction is often referred to clinically as compulsive sexual behavior disorder or hypersexuality disorder, capturing the essence of the problem, an ongoing inability to control sexual thoughts and behaviors despite adverse consequences. So today I'll zero in on sex addiction, what it is, why it happens, the toll that it takes, and how people recover. I'm also going to touch on the connections between process addictions and mental health issues like trauma, anxiety, depression, or substance use. While there are unique issues in the storyline or the narrative history of sex addicts, there are also many common threads of sex addiction. Some of these include using sex as a coping mechanism for emotional pain, gradually needing more of the behavior to get the same fix, failing to quit despite promises to oneself or another, and suffering real-life consequences like broken relationships, health scares, or work problems. There's also a stigma and a shame that can keep a person silent until a crisis forces change. They may be too ashamed to ask for help initially fearing judgment and having excused or hidden their addiction for years. Unfortunately, many people feel embarrassed and isolated due to the stigma around sex addiction, which can prevent them from seeking help. And I think this is why it's important to be talking about sex addiction, to lessen the stigma and make more people who are struggling with sex addiction aware that there are resources and help available. So let's talk about what exactly sex addiction is from a clinical standpoint. In the realm of addictions, process addictions or behavioral addictions are about being addicted to behaviors rather than substances. The activities themselves, whether it's betting money, eating, shopping, or having sex, becomes a compulsive need. Individuals with process addictions experience a high or a sense of relief while engaging in the behavior. And often there's guilt or remorse afterward. They typically struggle to control or to stop the behavior on their own, even as it begins to interfere with their health, their relationships, their job, or other important areas of their life. It's important to note that addicts are not engaging in sexual behaviors like sexual acting out or pornography use for recreational interests. They've become central in their life, what researchers call salience, meaning the addiction dominates their thoughts and their time. Sex addiction specifically can be defined as an unhealthy, compulsive preoccupation with sexual activities that the person continues despite negative consequences. I've talked with some people who struggle with that definition, or they want to add other layers to that. And I understand that usually the layers that they are adding are not things that we are not addressing in treatment or know is necessary to treat as part of treating sex addiction. I think there can still be this misunderstanding out there. And I don't know how prevalent it is. I think where I am, I don't know how representative the state that I reside in is of other states or other countries and what they are seeing. But the state that I live in, for professionals who are advertising that they treat sex addiction, a lot of the emphasis is simply on stopping the acting out, which is not going to lead to long-term recovery or even get them into a recovery that has stability. Usually what results is a short term of sobriety with a period of white knuckling before they relapse and seek out other resources or other therapy clinics, then take a different approach. So clinically, sex addiction is often described as compulsive sexual behavior disorder or hypersexuality. It's not just having a high libido. It's an out of control pattern where sex or sexually related behavior, like porn use, masturbation, etc., is used in a way that's akin to a drug. The person feels driven to seek the sexual fix, whether that's to relieve stress, anxiety, depression, or boredom, or to feel excitement, a rush, or to feel powerful. For a while, the behavior might soothe emotional pain. Sexual activity causes the brain to release dopamine, a feel-good neurotransmitter, which can momentarily lift someone out of negative feelings. However, this coping strategy ultimately backfires. Over time, the brain gets conditioned. It starts linking sexual behavior with relief or pleasure so strongly that it craves more and more of it. The cycle of addiction takes hold. There's a trigger, some type of emotional pain, craving, the ritual or the behavior, a temporary high or relief, followed back guilt and shame, which takes them right back to the emotional trigger. Each repetition of the addiction cycle often deepens the sense of shame and despair. And as tolerance builds, the behaviors often escalate in frequency or intensity in order to achieve the same high. Meanwhile, other parts of their life suffer, impacting every aspect of their. Another aspect worth noting is how real and serious the consequences of process addictions can be. Some people mistakenly think, well, if it's not a drug, it's not as dangerous. But ask someone who has lost their life savings to gambling, or whose marriage fell apart due to compulsive infidelity, or who developed type 2 diabetes and severe depression from years of food addiction. The damage is very real. Research indicates that the negative impacts of process addictions can span physical health, mental health, relationships, and finances. For example, compulsive overeating may result in obesity and the related illnesses that come with that. While a sex addict might put themselves at risk for sexually transmitted infections or sexual assault situations, or risk their finances. The secrecy and shame that accompany these behaviors also erodes one's social support network, which can worsen isolation. In short, behavioral addictions can be just as severe as chemical addictions in terms of life disruption, and they likewise require attention and treatment. Men and women, people of any background, any socioeconomic status or culture can find themselves caught in this compulsive pattern. Often underlying factors are at play. One major theme that emerges in the stories of sex addicts is unresolved trauma. Surviving trauma such as childhood abuse, neglect, or other deep emotional wounds can leave a person in chronic psychological distress. Sex or pornography, or even the thrill of romantic conquests can become a maladaptive way to cope with that distress. In clinical terms, the person is self-medicating their trauma symptoms with the intense distraction or soothing numbness the sexual release provides. For sex addicts, there is a backstory that often isn't fully explored or known to them. Growing up in a highly dysfunctional home where they never felt safe or loved or worthy, that kind of early trauma can lead to emotional dysregulation at very young ages, meaning difficulty managing stress or emotions. When they discover, usually at a young age, that sexual fantasy can give an escape, it's no surprise that the brain latches onto that relief. Studies and experts note a strong correlation between trauma and process addictions. Essentially, when someone's internal regulation is compromised by trauma, they turn to external behaviors, whether that's gaming, gambling, or sex, to feel in control or to escape reality. One angle that we can look at or work with sex addiction is sex addiction as an attachment disorder. At its core, sex addiction often stems from attachment wounds. Attachment theory explains how secure or insecure attachments form early in life, shaping our relationship patterns. Those with insecure attachments resulting from neglect, abandonment, or trauma are at risk of developing sex addiction as a maladaptive coping mechanism. They unconsciously use sexual activities to manage attachment anxieties or to avoid the anxieties. This leads to superficial and transactional relationships instead of meaningful emotional connections. Another angle to look at and work with sex addiction from is sex addiction as an emotional regulation disorder. Individuals often use compulsive sexual behaviors to numb intense feelings, such as anxiety, depression, anger, vulnerability, or unresolved trauma. Sex temporarily alleviates emotional distress, but leaves underlying issues unaddressed, creating a harmful cycle. Effective treatment must therefore focus not only on stopping behaviors, but also on addressing the emotional struggles that drive them. Another angle that I want to talk about later that I will work with clients from is sex addiction as an intimacy disorder, but I'll get into that later. Beyond trauma, however, there are often co-occurring mental health conditions intertwined with sex addiction. Depression, anxiety, PTSD, ADHD, or even personality disorders can coexist with or contribute to the addiction. These kinds of issues are not uncommon. In fact, people struggling with process addictions frequently also suffer from conditions like I just mentioned. Sometimes it's a chicken and egg situation. Did the depression lead them to seek comfort in compulsive sex? Did the chaos of the addiction help their ADHD or fuel their depression? Often both feed each other in a vicious cycle. What's clear is that effective treatment has to address both the addiction and any co-occurring mental health disorders together, rather than treating each one in isolation or separately. Another layer that we have to consider is how process addictions, like sex addiction, intersect with substance use. It's not unusual for someone to have both a substance addiction and a process addiction. For example, an individual might drink or use drugs to lower inhibitions to act out sexually, or vice versa. Engaging in sexual behavior might trigger substance use as part of their ritual. Clinicians have observed patterns, such as people who say, as soon as I have a drink, I feel the urge to visit a sex chat room. Or others who use stimulants like cocaine or meth, specifically to enhance sexual marathons. These combinations can be especially dangerous and require integrated treatment approaches, often referred to as co-addiction therapy, when treating both a behavioral and a substance addiction together. And then you can also have an individual who has multiple process addictions that also fuel a vicious cycle. Now let's talk about stigma. Unfortunately, sex addiction carries a heavy stigma in society. There's skepticism. Some people dismiss it as just an excuse for bad behavior or a moral failing. Others make jokes about it, given the sensational way sometimes it's portrayed in media, and others confuse it with being a sexual predator. This stigma can deeply affect those who are struggling. As I noted, many feel ashamed or embarrassed, and because of that, are reluctant to seek help. For clinicians and supporters, it's crucial to approach the issue without judgment. Remember that at its core, we're dealing with a form of addiction, a condition that has psychological and neurobiological underpinnings, not a simple lack of willpower. People with sex addiction are often in a lot of emotional pain and shame, and they frequently hate their behavior, but they feel unable to change it. As the American Addiction Centers note, even though sex addiction isn't formally in the DSM-5, people who struggle with this condition know all too well that it is real. And the growing number of support groups like SAA and rehab programs for sex addiction speak to the genuine need for help. So let's briefly dig into what's happening in the brain and the psyche of someone with a sex addiction. Earlier, I mentioned dopamine, the neurotransmitter of pleasure and reward. Just as drugs like cocaine or alcohol cause dopamine spikes, certain behaviors can do this too. Sexual arousal and orgasm naturally trigger dopamine release in the brain's reward centers. It's one of the reasons sex feels good. In sex addiction, the brain essentially becomes hooked on these reward cycles. Each time an addict engages in an addictive behavior, the brain gets a hit of dopamine and other neurochemicals. And over time, neural pathways learn feeling bad, sex will fix it. Feeling anxious, sex will fill it. Feeling stressed, sex will fill it. These pathways are strengthened, and alternative healthy ways of coping aren't being used. Neuroimaging research on behavioral addictions, like gambling or hypersexuality, suggests that these behaviors can engage the same brain circuits involved in drug addiction. People can develop tolerance, needing more stimulation for the same effect, and withdrawal symptoms, psychological distress when deprived, due to their brain changes. Psychologically, individuals struggling with sex addiction often hold distorted thought patterns that perpetuate their addictive cycle. In my clinical experience, I tend to see sex addicts fall into two broad categories. The way I explain it is the first category includes individuals whose core beliefs, such as I'm unlovable, or if people really knew me, they wouldn't accept me, are closer to the surface. These clients are usually more aware of their shame and can more readily identify the life experiences that shape these beliefs. Their addiction often functions as a coping mechanism for deep-seated shame, and their eroticized rage tends to stem from a sense of rejection or inadequacy, with sexual desire frequently projected onto women as a way to gain validation or power. The first group presents with shame-based vulnerability. These individuals are typically aware, at least on some level, of their emotional pain and hold core beliefs like, I'm unlovable, I'm broken, or if people really knew me, they'd reject me. Their addiction is fueled by an attempt to soothe this shame and avoid the pain of perceived inadequacy or abandonment. Sex becomes a way to feel temporarily desired, worthy, or in control. But the relief is fleeting. They often eroticize their shame and pain, and their rage, when it surfaces, tends to be emotionally charged and directed outward in a longing for recognition or power, often projected onto women. These clients usually have easier access to their emotional history and can identify early relational wounds, which makes the therapeutic process more direct. However, they can also become easily overwhelmed by their shame. And the work often involves pacing emotional exposure while helping them build self-compassion and resilience. The second category consists of individuals who are often high-achieving, charismatic, and outwardly successful. Their thinking tends to lean more toward entitlement and self-enhancement. Their internal narrative is less about unworthiness and more about being special, exceptional, or superior. For them, sex and seduction are less about numbing shame and more about reinforcing a carefully crafted self-image, one rooted in desirability, admiration, and dominance. Their compulsive sexual behavior often centers around the objectification of women, using conquest as a way to maintain feelings of power, success, and status. They crave being noticed, admired, and respected, not just sexually, but as a reflection of the identity they've built around success and influence. The second group tends to be image managed and entitlement driven. These are often high functioning, socially successful individuals. On the surface, they may not see their sexual behavior as problematic. Instead, it's framed as a reflection of their status, desirability, or even their success. Their internal narrative is shaped less by shame and more by entitlement, superiority, and a compulsive need to be seen, wanted, and admired. They seek excitement and validation, often using sex as a tool for self-affirmation rather than self-soothing. Their eroticized rage is less about emotional pain and more about dominance, power, control, or conquest. Objectifying women to maintain their inflated yet fragile self-image. Unlike the shame-based group, these individuals often resist acknowledging their behavior as addictive. They may minimize consequences, rationalize their actions, or compare themselves favorably to others they view as real addicts. Therapeutically, it's harder to access their emotional wounds because they've built strong defenses rooted in performance, charm, and control. The early work in treatment often focuses on exposing the cost of their relational detachment, people-pleasing, competitiveness, and their compulsive need to impress, particularly in male-dominated environments. This starts to soften the armor and begins to reveal the deeper attachment wounds and emotional voids beneath their performance-based self-worth. While both groups are driven by cognitive distortions, their emotional blueprints differ. Shame-based addicts seek to be loved, but feel unworthy of it. Entitlement-driven addicts crave admiration, but fear genuine vulnerability. One seeks connection, but doesn't believe they deserve it. The other avoids connection to preserve control. Both are intimacy impaired, but for different reasons. One fears rejection, the other fears exposure. These distinctions shape how we have to approach treatment. Shame-based individuals need containment and repair. They benefit from attachment-focused work that validates their pain and helps them develop emotional regulation and self-acceptance. The entitled, high-achieving addicts need to confront the limits of performance and status and experience the vulnerability they've spent a lifetime avoiding. For both, the path to healing involves slowly restoring their capacity for intimacy, starting with a therapeutic relationship. But how we enter that work and how long it takes to get there varies significantly, depending on which emotional architecture we're navigating. In both cases, sex is not really about sex. It's a symptom, one rooted in unmet relational needs, faulty beliefs about the self, and the absence of emotional safety. Healing comes not from controlling the behavior alone, but from building a life where closeness is safe, emotions are tolerable, and they can regulate them, and the self is no longer defined by validation, conquest, or avoidance. Despite appearing quite different on the surface, both groups are driven by cognitive distortions, deeply ingrained and inaccurate beliefs about themselves and others that keep them stuck. Many also experience obsessive thinking, where sexual fantasies or preoccupations become intrusive and difficult to control. What's important to understand is that these two groups often require different therapeutic approaches. The high-achieving sex addict often resists identifying as an addict. They may see their sexual behavior as a natural extension of their success, rather than a problem. This resistance stems in part from seeing themselves as different from the typical addict, more in control, more socially acceptable, and even admired for their desirability. After all, how can they be an addict when they've achieved such success? I've said this before in other podcasts. I don't argue with clients over labels. If that's not a label that they want to pick up, I'm not going to get into a power struggle over that. I've found it's often more effective to approach these individuals by exploring their people-pleasing behaviors, their compulsive need for attention, and their drive to impress, which is often targeted toward other successful men. While they may not present with overt shame, many still harbor unresolved attachment wounds and internalized negative beliefs about their worth. These underlying issues are simply more deeply buried beneath layers of image management and social validation. It takes longer to access the core pain in these clients because their protective posturing is reinforced by external success and a sense of being part of a privileged minority. Most people enjoy being admired or respected. But when this desire becomes compulsive, when it's used as a constant means to regulate self-worth, it often leads to chronic dissatisfaction, emotional emptiness, and eventual burnout. What initially appears to be a winning formula for success and validation turns out to be a fragile defense against unresolved relational wounds. And that's where the real work of healing begins. Treating process addictions are different than substance addictions because stopping the behavior isn't possible and isn't healthy. Becoming sexually anorexic, rigid eating in response to overeating, or compulsively not spending money aren't fixes to process addictions. And this takes me back to the psychological aspect I talked about, the issue of emotional regulation. Most people with sex addiction report that it's not really about sex. It's about managing emotions or managing an image. Their trauma history, attachment wounds, and anxiety and depression are often at the root. Sex addiction usually lacks a true emotional intimacy component. And this is where intimacy disorder comes in. For them, the act of being sexual is not about forming closeness, but rather about relieving internal tension, escaping reality, or being seen. The drive for sexual acting out often comes from unmet psychological needs, like relieving anxiety, filling a void of low self-worth, image management, or covering up the attachment wounds with high confidence, rather than a healthy desire for intimacy. Understanding this helps guide treatment. It means recovery isn't just about stopping sexual behaviors. It's also about healing the underlying emotional wounds and learning new ways to cope with feelings. The great news is that recovery is absolutely possible. People break free from sex addiction every day with the right support and strategies. There are multiple effective therapeutic approaches for sex addiction and other process addictions. And often a combination is used to address the many facets of the disorder. So let's talk about some of the common treatment components and approaches. One-on-one therapy with a clinician experienced in behavior addictions is foundational. these therapists need to be working with the therapeutic relationship from an interpersonal approach, helping their clients uncover the root causes of their addiction and begin to develop healthier coping skills. A particularly effective modality, especially early on in treatment, is cognitive behavioral therapy, or CBT. CBT helps identify and change the dysfunctional thoughts that drive compulsive behavior. As part of CBT, we identify the compulsive thoughts driven by negative beliefs about self that are driving the behaviors, and we start to recognize the cognitive distortions. They may have served a purpose when these distortions were formed, but at some level, they are no longer working. As part of CBT, we also explore the triggers for relapse and form a plan for trigger management and healthy coping strategies. We'll also explore the reasons they want to be sober and what they imagine a life in recovery for them looks like. It's important to note that they are often underestimating what their life in recovery looks like. But it's also helpful for me to know where we're starting, since trauma is so often an underlying factor. To help process painful past experiences that fuel the addiction, there's also a need for trauma-focused therapies. Initially, we help clients explore their underlying emotions before moving into the work of healing trauma. The key with trauma-focused therapies is a tailored treatment plan. Good programs will create a tailored plan utilizing a unique combination of therapies, which address each individual's specific needs. And I will say that for some addicts, they have that understanding, or they learn that sex addiction has trauma underlying it. And initially they work with a therapist who advertises that they treat trauma. That isn't really a holistic approach to treating their problematic sexual behavior. And starting trauma work too early often leads to relapsing and continuing the addictive behavior. Depending on the severity of the addiction, some people benefit from intensive treatment in a residential setting. There are rehab centers and intensive workshops specifically for sex addiction. In a residential program, clients can focus fully on recovery in a trigger-free, supportive environment. They typically receive daily therapy, group work, educational workshops, and sometimes family therapy. Residential treatment can be a game changer, especially if someone's environment is full of triggers, or if they need to break a deeply ingrained routine. Shorter intensives, like 2-week intensive programs, also exist and can jumpstart recovery for some. The choice between inpatient and outpatient often depends on how severe the addiction is and what a person's life circumstances allow. If they start with inpatient, they will still need to continue with outpatient once they are discharged from the residential program. There is also incredible power in support groups or therapy groups. Group therapy that's led by a professional helps break the isolation and shame that thrive in sex addiction. Peer support groups involve 12-step programs and other peer-led recovery programs. 12-step groups have become more popular since COVID because of their availability for online resources. 12-step online groups were available before COVID-19. However, most people were going to in-person meetings. And if there was not a lot of choices for 12-step meetings where the culture was focused on the solution instead of the problem, then people were stuck. so to speak, when it came to 12-step programs. Clients that I work with have benefited greatly from access to online support groups because there are so many people who are using the online programs compared to prior to COVID-19. In 12-step meetings, people share their experience, strength, and hope. There are differences between support groups and group therapy. Both have a powerful role to play for people in recovery. As I emphasized earlier, if there are co-occurring mental health disorders or substance use disorders, a good treatment plan will also address those simultaneously. This might mean medication to manage depression or anxiety if needed, psychiatric care, or concurrent substance abuse treatment. There are some rehabs who have programs offering dual diagnosis tracks for this very reason, in order to form a holistic approach to recovery. Sex addiction, we know, doesn't just affect the addict. It affects their loved ones, especially intimate partners. Involving partners in therapy can be crucial. Many treatment centers provide partner support programs or family therapy sessions so that spouses can also process their feelings of betrayal, learn about the addiction. Partners often need support in setting healthy boundaries, deciding what's right for them. In these programs, they can lay the groundwork for possibly rebuilding trust. And even if a relationship doesn't survive, therapy can help both parties heal individually, making them better at co-parenting. If the person with addiction is a parent, sometimes family therapy with children or parenting counseling is also appropriate to address family system issues. And then one of the last things I want to talk about in looking at treatment programs is relational recovery. An important part of their treatment is relational recovery. A relationship where there is a history of sex addiction is a relationship with imbalanced power dynamics. Often the addicted partner has power over their partner, even though many times they may feel like they are in a power under dynamic, which may fuel part of their reasoning for acting out. However, when there are secrets and non-consensual behaviors that impact the relationship, the one engaging in the behavior is in a power over dynamic. Initially, relational recovery relies on differentiation. Differentiation refers to the ability to maintain a sense of self, including thoughts, feelings, and values, while also being connected and emotionally close to others. It's about finding a balance between individuality and autonomy and closeness in relationships, often within the context of intimate connection. As the individual begins to have more of a sense of differentiation, we also start working on attachment skills that prioritize teaming and partnering so that we can work on attachment repair. We know that neurobiologically, attachment repair is limbic system revision. Growing neural pathways for safety and allowing the nervous system to relearn safety in close relationships. Unhealed injuries will haunt the relationship and prevent them from moving forward to safety, whether that's for the addict alone or the couple together. It's important to note that attachment injuries can be an event, or it can be a meaning that is made, usually a trauma belief or a belief that's created of the self. Attachment injuries are a feeling state, and they are a multi-layered wound from childhood into adulthood. This may be from childhood into addiction, or from childhood into adult relationships with addiction. For healing to happen, they have to be able to move from their secondary emotions to their primary emotions. Secondary emotions are reactive and protective. If you think about the two groups that I broadly placed sex addicts into, both of the different cognitive distortions that they have can also be seen as protective and reactive. Primary emotions, on the other hand, are connected to attachment needs. They go all the way to the core wound, feeling unwanted, unlovable, not enough, unsafe, or overly responsible. Creating understanding of the attachment injuries and being able to heal them relationally creates attunement between the couple, where they can move through the roles of giver and receiver fluidly, while staying open as they listen to their partner's pain and grief, allowing all the emotions from all of the angles to be expressed and received. Beyond attachment and emotional regulation, sex addiction profoundly impacts intimacy. Genuine intimacy or deep emotional connections often feel unsafe for those with unresolved trauma or deep-seated fears of vulnerability. For the couple moving forward or the individuals moving forward, these injuries must be resolved in order for the person to engage in relationships from a safe base. If not, the addict often will seek shallow connections that demand little emotional risk, and partners may enter into another relationship where they settle for what seems to be deep emotional connection, but instead actually involves little emotional risk. Intimacy disorders aren't necessarily a lack of desire for closeness, but rather an inability to achieve or maintain intimacy due to underlying emotional or psychological barriers. The path to recovery from sex addiction involves many corrective emotional experiences. Therapy sessions provide a safe space to practice new ways of connecting, both with oneself and with others, in vulnerable ways. Therapists help individuals experience healthy relationships with healthy boundaries and genuine intimacy, which can help to gradually rewrite their emotional scripts. Psychologist Carl Jung said, emotional well-being is the ability to integrate all parts of the self. Recovery becomes not just about stopping compulsive behaviors, but about developing healthy, secure emotional bonds, both with yourself and with others. I want to end with a powerful reflection that's often shared in recovery rooms. And that is, quote, "You can't go back and change the beginning, but you can start where you are and change the ending," end quote. Recovery is about changing the ending, and it starts now. No one is beyond help, and it's never too late for a new beginning. Until next time, take care of yourselves and each other. And at the end of this episode, I want to remind you that your story matters. Remember, there's something meaningful in every chapter. Don't wait to share your story until it's finished. Until next time, Jackie.